been a lot of studies out there showing that people with low vitamin D have got, and it's quite significant, 40% higher risk for developing dementia, which is hugely significant. Low levels of vitamin D increases the rate of aging in people. The more prone you are to not just dementia, but all of your aging diseases, cardiovascular disease. We're talking about bone health, all of that.
And I think people underestimate it. They think it's just this thing that we get from sunlight and it's good to have it. And it's not really critical if your levels are low. We tend to measure it with very, very wide ranges of acceptable levels. But actually, there is a sweet spot where we want really everyone to be. Morning, Charmaine.
Morning, Jean. It's that time of year.
It is indeed that time of year. I think we're all aware of the lack of sunlight. It's only been for a week since the clock's changed, and I'm already seeing things dip in practice with patients. I don't know if you are.
Absolutely. I think this year in particular, that change has been really quite hard for lots of people. I packed away my summer clothes and the winter things are out, but it's the lighting, I think, that has the biggest impact for most people.
Absolutely. Your winter clothes, you can see me. I'm in my lovely pullovers now. It feels like I need them. But yes, it's that lack of light, especially. I mean, obviously, I'm slightly further north than you are. It's very, very noticeable up here. The lack of light, and of course, we're going to talk about everything to do with vitamin D this morning.
Vitamin D, absolutely so critical for the brain. I mean, there've been a lot of studies out there showing that people with low vitamin D have got, and it's quite significant, 40% higher risk for developing dementia, which is hugely significant. And I think there was a vital study as well that was published earlier this year showing that low levels of vitamin D increases the rate of aging in people. And of course, the faster you age, the more prone you are to not just dementia, but all of your aging diseases, cardiovascular disease. We're talking about bone health, all of that.
Yeah, and I think people underestimate it. They think it's just this thing that we get from sunlight and it's good to have it. And it's not really critical if your levels are low. We tend to measure it with very, very wide ranges of acceptable levels. But actually, there is a sweet spot where we want really everyone to be. And we tend to forget that it's not just a kind of immune regulator. It helps our adaptive immune response. It's also an anti-inflammatory. That's a really, really important thing. And certainly from my point of view, from a herbalist point of view, it really supports respiratory health. It's directly associated with a lower risk of respiratory infections because it helps the lining of the lungs. It does so many things in the body as well as the brain. And we tend to sit at very low levels in this country.
Yeah, absolutely. So, I mean, obviously, we just don't get enough sun in Scotland, and the angle at which the sun comes is affected because of, how far north we are. So in Scotland, everybody should be taking vitamin D, even if you are getting out into sunlight. That is really an important one to be taking from October to March anyway. But for many people, even throughout the whole year, it's necessary.
I certainly recommend my patients take it the whole year. Some of the recent tests I've done on patients, some of the recent blood work that I've done on people in Edinburgh in particular, so that's less north than I am at the moment. Even although people are taking something like 2,000 a day, some of these patients are still even out with the NHS levels of normal, or just within the bottom boundaries, and that's 2,000 IU. I routinely take 5,000 IU, and I struggle to get up to that middle range with that, which is why I sometimes have injections of it.
Yeah, and I think that it's also a good reason to test because, I have patients who are on 4,000 a day and still come up low because a lot of it is also genetic, your genetic capacity for transporting and utilizing vitamin D. So I'm a very big believer in testing, kind of knowing where your levels are, just because, what you said earlier on, it's so critical for immune system. It's critical for brain health. The brain's got receptors for vitamin D, bone health, hormones, actually. So, there's lots of reasons why you do want to get this optimized, and knowing where you are in that test range is really important.
Yeah, absolutely. Absolutely. I agree. And so, yeah, I mean, my recommendation is always I start people on 5,000 IU, but I usually do test them. It's one of the vitamins that you can overdose on, that it is fat soluble. And so it is a good idea, as Charmaine says, to test and to keep an eye on that. One of the difficulties is that the NHS are not testing because they recognize that everyone's deficient. And so it's a kind of waste of a test, but at the same time, the recommendations that they're giving are too low. So yeah, so I would say to anyone, vitamin D is your best friend, especially if you're living in Scotland at the present moment. You need it. So get full of it for winter time. I would definitely suggest 5,000 IU over the winter months and then retest. It's not expensive. It's not expensive to test it.
Yeah. Absolutely. And also just making sure people have enough vitamin K, because of course, if you don't have enough vitamin K to go alongside that, you are going to find things like calcium depositing in your blood vessels. So making sure you've got enough vitamin K. And then also what's really important for vitamin D absorption is magnesium. So, vitamin K, and magnesium need to be optimized so that you get the best out of your vitamin D. But yeah, absolutely. Everyone needs to be on vitamin D.
Absolutely. And one last thing I was going to say is, I'm working with quite a few ladies of menopausal age who are worried about osteopenia and osteoporosis. And when I was testing their bloods, quite happily going along with the levels of calcium are okay. So the calcium levels in the blood were all right, but the parathyroid hormone was overactive because their vitamin D levels were in their boots. So that calcium is there,
Mhm.
but is it getting into the bones? And that's what we really want to be aware of as well.
Well, I hope that you have a really good brain day today.
Thank you. You too. And I'll see you later.
See you later.
Bye.